Hello, everyone. My name is Leena. I'll begin our presentation by introducing the connection between Gestalt therapy and the body, a fundamental aspect of how this therapeutic approach fosters self awareness and emotional healing. Gestalt therapy was founded in the 1940s and 50s by Fritz Perls, along with Laura Perls and Paul Goodman. Fritz Perls, a German born psychiatrist and psychoanalyst, developed Gestalt therapy in response to what he saw as the limitations of traditional psychoanalysis. He aimed to create a more present focused and embodied approach that viewed the person as a whole, not just as a set of symptoms. At its core, Gestalt therapy is centered on the here and now experience. Instead of digging into past memories in isolation, clients are invited to explore their current emotional, mental, and physical experience. This includes tuning into what's happening in their body. This focus is powerful because emotions often surface in the body before they become conscious thoughts. So, for example, someone might not realize they're anxious, but they notice their hands shaking or breathing becomes shallow. In Gestalt, the body becomes a doorway into unfinished emotional business. It brings hidden feelings into awareness. So imagine a client speaking about something difficult, and their posture shifts or their voice becomes tense. A Gestalt therapist might gently ask, "Can you notice what's happening in your body right now?" Or, "What's going on with your breath as you talk about this?" These questions help clients stay present with the experience instead of escaping into analysis. Often this uncovers deeper emotions, grief, fear, anger, that haven't yet been fully processed. This emphasis on body awareness isn't just a method. It's grounded in two key philosophical roots: phenomenology and existentialism. Phenomenology encourages us to observe lived experience as it is, without judgment or interpretation. It values awareness over explanation. Existentialism as the idea that individuals are responsible for how they interpret and give meaning to their experiences. It emphasizes choice, it emphasizes freedom and authenticity. Together, these philosophies shape Gestalt therapy's view that self-awareness, including awareness of the body, is essential for living a more intentional and emotionally integrated life. So, to sum up, Gestalt therapy treats the body not as separate from the mind, but as an essential part of emotional insight. Sensations like tension, posture shifts, or changes in breath offer vital clues to our inner state. When we bring awareness to these, we unlock a fuller understanding of ourselves. Let's now explore some of the theoretical ideas that explain why body awareness plays such a key role in Gestalt therapy. Gestalt theory is built on the belief that the body, mind, and emotions are deeply interconnected. We can't fully understand our emotional lives by focusing on thoughts alone. Physical sensations and emotional responses inform each other constantly. So, for instance, sadness might show up not only as tears, but also as a heavy chest or slumped posture. This is why Gestalt therapists work closely with sensory experience. Healing doesn't just happen through talking, it happens through noticing what's happening in the body. Instead of asking clients to talk about feelings, therapists help them stay with those feelings in the moment. So let's say a client says, "I'm fine," but their body language tells a different story. Their jaw is clenched, their fists are tight. The therapist might ask, "What's it like to hold your fists like that?" Or, "Can you stay with that tension and see what comes up?" These questions are simple, but can lead to powerful moments of insight. The client might realize they're feeling angry or scared, even if they hadn't been able to admit that before. This approach ties into one of Gestalt's central ideas that awareness is the foundation for change. We can't shift patterns we don't even realize we are in. Once someone starts noticing how they react physically to certain situations, tightening their stomach, holding their breath, or withdrawing their energy, they begin to see how these responses reflect emotional adaptations they've carried for years. And with that awareness comes choice. Clients might begin to breathe more deeply, express their feelings instead of suppressing them, or stay with discomfort long enough to understand it better. These small physical shifts often open the door to deeper emotional change. So, to wrap up, body awareness in Gestalt therapy isn't a side practice, it's central to the therapeutic process. It allows clients to access parts of themselves that words can't always reach. And by becoming more aware of how they feel, move, and hold emotion in the body, they begin to live and relate more authentically. I'll move it now to my colleague with the next set of slides.
Let's talk about the body as a channel of awareness. In Gestalt therapy, the body isn't just something we observe, it's a central tool for awareness. Our physical sensations often hold the key to emotions we haven't yet named. For example, a tight jaw or shallow breath can be early signs of anger or anxiety, even before the client can put it into words. As therapists, we pay close attention to bodily cues, posture, movement of breath, tension, not just in our client but in ourselves too. These non-verbal signals can tell us what's happening beneath the surface, especially when words are missing or guarded. The shared body awareness creates a deeper, more authentic connection because sometimes the body speaks what the mind cannot yet say. Now let's talk about grounding in the present moment. Gestalt therapy also emphasizes the importance of the here and now, and the body is one of the most reliable ways to access it. For example, when a client becomes aware of their physical experience, perhaps noticing the weight of their feet on the ground or the tension in their chest, it brings them out of rumination and back into the present moment. This kind of embodied attention helps interrupt cognitive avoidance. Instead of spiraling into old narratives or future worries, the client can start to feel what's happening right now. It also deepens emotional contact, both with themselves and with the therapist. By tuning into the body, the session becomes more grounded, more relational, and more real. In Gestalt, we trust the wisdom of the body. It doesn't lie, and it always lives in the present.
Hi everyone, I'll be talking about some of the techniques and interventions Gestalt therapists use to support body awareness in clients. These methods help clients connect with emotions that might be buried deep, but still present in the body. Gestalt therapy is rooted in the idea that the mind and body are interconnected. So, when clients feel stuck emotionally, their bodies often hold important clues. Let's start with the first technique, exaggeration. In this method, the therapist observes small, unconscious movements like tapping fingers or shifting in the seat and invites the client to exaggerate that action. For example, if someone is wriggling their hands, the therapist might say, "Can you make that movement bigger?" As the movement grows, clients often become aware of the underlying feeling, maybe anxiety, frustration, or even grief. It's like turning up the volume on the body's message. Next is body scanning. This involves guiding the client to check in with different parts of their body, one area at a time. The goal is to bring awareness to things like tightness, shallow breathing, or numbness. A therapist might ask, "What's happening in your chest right now?" Or, "Do you notice any sensation in your hands or stomach?" Often, this creates space for clients to name emotions they haven't consciously processed, because the body remembers what the mind forgets. Finally, physical metaphors are used to link body and emotion. Rather than analyzing a feeling logically, the therapist might ask, "Where do you feel that in your body?" Or, "If that emotion had a color, shape, or texture, what would it be?" This technique helps people externalize emotions and see them more clearly. It taps into the creative sensory parts of the mind and can be especially powerful with clients who struggle to express emotions with words. Of course, doing body-based work in therapy requires a lot of sensitivity and safety. The first thing therapists assess is the client's readiness. For example, someone with trauma might disassociate when asked to feel their body. So body awareness isn't something you jump into. It's something you ease into, gently. Therapists are trained to look for signs of overwhelm, freeze responses, or discomfort. If any of those show up, they slow things down or change direction entirely. Another important factor is respecting boundaries, both personal and cultural. In some cultures of families, bodily expression may not be encouraged. Some people feel shame around their bodies. That needs to be acknowledged, not pushed past. The therapist must respect the client's rhythm and values. So in Gestalt therapy, body awareness is always invited, but never imposed. The therapist might offer, would it feel okay to explore what's happening in your body right now? The key is to give clients control. When people feel safe, they begin to access deeper truths without fear of being judged or re-traumatized. Here's a quick example. A client tapping their foot repeatedly during a session. The therapist gently notices and asks, can you exaggerate that tapping? The client begins stomping a little and suddenly says, I'm actually really angry. I don't even realize how much until now. That simple invitation allowed something hidden to emerge through the body before the client could even name it. So, to sum this up, Gestalt therapy doesn't just ask, what are you feeling? It also asks, where are you feeling it? How is it showing up in your body? Through techniques like exaggeration, body scanning, and physical metaphors, done with care and cultural sensitivity, clients gain a more complete picture of their inner world. Thank you.
Pain. As Pearl said, you never overcome anything by resisting it. When we resist emotions mentally, that resistance often shows up physically. Anxiety becomes tight shoulders, suppressed anger becomes jaw tension or stomach pain, grief becomes a heavy chest or lump in the throat. So resistance is holding, tightening, numbing. To overcome this, we need to talk ourselves out of it. Feel it in the body. Body awareness helps us notice this resistance. By tuning into where we are tense, numb, or disconnected, we begin to access what's really going on. So, what is paradox? Go deeper, be more spiteful, perform more, feel more. Going deeper into an emotion or experience isn't just a mental exercise, it's a bodily one. When you feel into an experience deeply, you breathe into the sensation, you allow the tension to intensify, shift, or move. You become curious about what the body is telling you. Emotions live in the body. To process them fully, we must enter the body's experience. That's going deeper. If you are spiteful, be more spiteful. Whatever it is, go fully into it. This aligns with somatic amplification practices. For example, in Gestalt therapy, if you are clenching your fist, a therapist might say, clench it more. What does it mean for you? In somatic experiences, if there is tightness in your throat, you explore the tension, follow it more, let it express. By intensifying awarenesses, not the behavior itself, you let the body complete an unfinished emotional cycle. According to Pulse, when you have doubt, swing with your pain, swing with your restlessness. Whatever is there, swing with it. This is an invitation to move with your body's impulses. Let your body tremble, cry, shake, stretch. Trust that your body knows how to process what the mind avoids. Emotions and trauma move through the body like waves. If you let them pass without resistance, that wave completes and regulation is restored. This is why the practices like somatic therapy, focusing, bioenergetics, mindfulness based body scan are so powerful. They help us feel emotions in the body instead of intellectualizing or avoiding it. So, the key takeaways from today's presentation are: Gestalt therapy integrates mind, body, and emotions. Body awareness reveals deeper emotional insights. Techniques like exaggeration and body scanning bridge unconscious emotions, conscious experiences. Safety, sensitivity, and culture awareness are essential in body focused work.